Thanks again. I now invite Dr. Hasmukh Shah to introduce an exciting new initiative by BAPIO Wales. Dr. Hasmukh Shah.
BAPIO Wales has been in discussion with the Cardiff and Vale University Health Board about a mutually beneficial partnership. Now I invite Professor Singh, MBE, outline a memorandum of understanding between the BAPIO and the Cardiff and Vale University Health Board.
Ladies and gentlemen, it's a great pleasure to be here today to announce that BAPIO has entered into a memorandum of understanding with the largest health board in Wales, the Cardiff and Vale University Health Board. It is indeed a very pleasant surprise that when I first approached Stuart Walker, the medical director of the health board, his response was absolutely positive and instantaneous. And we were very, very happy to recognize that Cardiff and Vale University Health Board were a pathfinder organization in terms of the treatment of their ethnic minority staff. And from there on, we developed this memorandum of understanding. And to shed a bit more light on it, I'd like to invite Mr. Len Richards, Chief Executive of the Health Board. Mr. Len Richards.
Yeah.
I'd then like to invite Dr. Stuart Walker, the Executive Medical Director of the University of Cardiff and Vale University Health Board. And finally, may I invite Dr. Ramesh Mehta, the President of BAPIO UK, who actually was the prime instigator and mover of asking me to get onto this MOU. May I ask Dr. Ramesh Mehta first, if he'll be kind enough to set the scene about the MOU, and we'll then hear from Mr. Len Richards and Dr. Stuart Walker in that order. Dr. Mehta.
Thanks, Keshav. Dr. Stuart Walker, Mr. Len Richard, and ladies and gentlemen. It's a great pleasure, and I'm so delighted that the biggest trust in Wales, Cardiff and Vale University Health Board, have agreed to be partners with BAPIO by signing this MOU. Actually, we started concept of having partnership with different hospital trusts over the last few years. And I'm very pleased to announce that we already have several partnerships in England. Wales division of BAPIO has been one of the most active divisions of BAPIO, and Wales people have been lovely, lovely. My visits to Cardiff and Swansea have been so enjoyable because of lovely people there. Now, the concept of the partnership is very important. We and Lord Kacker has already said how there is a differential treatment of BME staff, whether it's doctors, nurses, or other staff. What we are hoping to do through this partnership is improve the staff morale by providing cultural training to the staff in general. So that's one important part. Second one is supporting the race equality issues and promoting equality, diversity, and inclusion. However, that's not all. We are also very keen to support conflict resolution in very early stages. So we have trained 12 consultants through ACAS in negotiations, and the chair of the hospital unit in Wales will lead the conflict resolution issues. We are also now offering support with recruitment and retention of staff. BAPIO Training Academy is involved in ethical recruitment of doctors and nurses from India. And this is going to be a transparent, economical, and ethical way of getting staff where required. So, there are lots of advantages to both the trust as well as staff with this partnership. So with that brief note, I thank the management of Cardiff and Well University Health Board. Thanks Len, thanks Stuart for this great occasion. This is the first one in Wales, and I'm hoping that other hospital trusts in Wales will follow this initiative. Thank you very much.
Thank you, Dr. Mehta. Could I invite Mr. Len Richards, Chief Executive of the Cardiff Vale University Health Board, to say a few words, please.
Okay, thank you very much, Keshav, and I'm absolutely delighted and honoured to be here as the signatory of the Memorandum of Understanding. This is the first of its kind between Cardiff and Vale University Health Board and the British Association of Physicians of Indian Origin. And I believe it demonstrates the commitment and willingness of us all to drive forward meaningful and tangible change. The NHS is one of the world's largest employers and globally is one of the world's recognised providers of excellent healthcare. This is in the main due to the people it employs and the professional services it delivers on a 24/7, 365 days a year. And our NHS is the envy of the modern world, as it's free at the point of delivery, and as a result, our population is afforded a healthcare system second to none in the Western world, and our chances of maintaining a long and healthy life is greatly improved by having access to what the NHS offers, but importantly, having access to the skills and the expertise of its staff. So our staff, clinicians and physicians make an enormous contribution to this. And I've been fortunate to work across health systems around the world and have seen at first hand how the culture and diversity of an organization can also contribute enormously to better patient outcomes. Cardiff is the 10th largest city in the UK, one of the youngest and fastest growing European cities. It has over 94 languages spoken by its residents, and of this population, almost 20% are Black, Asian, and minority ethnic people, with the vast majority of just over 40% of those from Asian or British Asian origin. Our aim is to ensure that our organisation is reflective of the communities we provide health services for. I'm proud of the fact that Cardiff and Vale Health Board is an inclusive employer and not only welcomes but thrives on the diversity of its staff, benefiting hugely from the cultural and multi-heritage that the nationalities bring to the health service. As Chief Executive of the Health Board, I've taken a lead role in the engagement and promotion of race and how we tackle issues of inequality across the Health Board. It's disheartening in one respect, we still have to do this, but it's vitally important that we continue to drive the core values of inclusivity and diversity forward at every opportunity in 2021. It's been difficult to meet with my colleagues during the current COVID-19 restrictions, but following the unrest after the death of George Floyd in the States and the protests across the UK, including here in Cardiff, and also the recognised inequalities in the way in which the pandemic has hit both our staff and the communities, I felt it really important to establish those conversations sooner rather than later. So along with Keith Lee Wilkinson, our Equalities and Diversity Manager, I've been meeting with groups of staff to find out what it's like for them to work within our organisation, to understand their issues and concerns from a personal as well as a professional perspective. Despite working around the globe in many different cultures, I've learned a lot, in particular, that staff from ethnic minority backgrounds still have a different and unequal experience in the workplace compared to their white colleagues. It's been important to see our organisation from a different perspective, and the Memorandum of Understanding will help us work on this. There is clearly a lot more for us to do. So I'm delighted that the Health Board and BAPIO have agreed to collaborate to support the advancement of equality, diversity and inclusion across Cardiff and the Vale Health Board. As one of the fastest growing cities, it's vitally important that we continue to attract, recruit and also retain the best clinical staff from across the globe. We will only do this if we continue to open up dialogue and uncover barriers and find a way forward to ensure that everyone feels themselves an equal in the community as well as in the workplace. I've been clear that I want to continue through my personal leadership and our leadership programs right down to the grassroots of our organisation, an allyship and support of Black and minority ethnic organisations that will add value and contribute to a more positive and inclusive working environment. This is how we will continue to drive through tangible but also meaningful change. My aim by signing the MOU is to demonstrate my personal commitment to these areas, to continue to tackle inequality and call out and challenge unacceptable behaviour, but equally to actively promote inclusion and diversity across all of our clinical areas and support staff services. As one of the leading health boards across Wales, it's vitally important that we are not just talking about inclusivity, but actively practicing it, and that our staff, from whichever their cultural background and heritage, are seen to be a valued member of the health board and a valued member of the NHS here within Wales. So I'd like to just say thank you for inviting me to speak here today. It's been a real privilege to be a part of this, and I very much look forward to continue to work with you to develop the impact and the rollout of the Memorandum of Understanding and its ambitions in promoting a more inclusive and diverse workplace for us all. Thank you.
Thank you very much, Len. Stuart, would you like to say a few words, please?
Yes, thank you very much, Kesh. I will just follow up on what Len has said. I'll refer back to what you said a moment ago, which is when you first approached me and asked us to consider joining you in this MOU. And I think, and I'm absolutely delighted, in fact, with how you have interpreted our initial response to that, which was indeed one of absolute pleasure to be asked to take part. I had two overwhelming sensations actually when you came to us, Kesh, and asked us to do this. The first was one of, as Len has just said, of being honoured that we were invited by BAPIO to join you in this MOU, but also very grateful, and grateful for the opportunity, both personally and publicly, to demonstrate on behalf of Cardiff and Vale University Health Board our absolute commitment to this agenda. And I think it is, if I can say this, no surprise that you came to us, because I think we have publicly demonstrated how much importance we attach to the equality and diversity agenda and the integration processes therein. And so I was genuinely honoured and delighted and grateful when you came to us, Kesh. So I'm now really pleased to be joining Len on behalf of Cardiff and Vale in signing this MOU. It does mean something for me personally, and it also means something for me on behalf of Vale University Health Board. I think the real key for me, though, is what Len's just alluded to. It's really important now for us to publicly sign this MOU and demonstrate our commitment. But also, most importantly, it's how we now take this forward. It's our next steps that really matter, and how we utilise this MOU to really push our equality and diversity agenda and take our commitment to all of our staff, no matter what their background and origin, and all of our patients and the services we provide forward. So thanks. So I'm going to finish up because I didn't want to take too long. But I just wanted to say, Kesh, thank you to you personally for this opportunity that you've come to us with and giving us the chance to join you at this really fantastic day, and to publicly display via this MOU our commitment to
Thank you,
you
Stuart.
and your colleagues in BAPIO.
We'd sign our MOUs virtually today, but each of us has a copy, followed by which we will exchange them at the appropriate time. So could I please ask you all to sign your copies? Thank you.
Thank you.
Thank you so much, Len and Stuart, for really taking this forward. We're very appreciative that you've proved yourself to be a pathfinder organization, and we look forward to working with you very actively. Thank you so much.
Thanks, Keshav. I hope, as many have said, that this initiative, this MOU, is the first of many. I will now invite Dr. Viju Vardarajan, consultant anesthetist, to introduce our next speaker, the Deputy Minister and Chief Whip, Jane Hutt, MS, who will discuss issues around racial inequalities during COVID.
Good morning. Friendship and loyalty isn't about whom you know the longest, but it's about who comes along and says, I'm here for you, and proves it time and again. It's my privilege to introduce BAPIO's one such loyal friend, Ms. Jane Hutt, currently our Deputy Minister and Chief Whip in the Welsh Assembly Government. Ms. Hutt grew up in Africa and received her higher education in Britain in some of the prestigious institutions, including the London School of Economics. She was an elected member of the South Glamorgan County Council for 12 years, and since the Welsh Assembly Government's inception in 1999, has held many distinguished and important ministerial portfolios, including health, education, and finance. She is one of the Welsh Assembly Government's longest serving minister. She's also a honorary fellow of Cardiff Met University and Cardiff Vale College. Ms. Hutt, please.
Borodar Pal, good morning, and thank you very much for inviting me to speak at today's BAPIO conference. And can I start by thanking Professor Keshav Singhal and Dr. Hasmukh Shah for organising this conference with such an excellent programme, which enables us all to come together, as the First Minister has said, ministers, elected representatives, academics, health professionals and managers, many of whom are at the front line of the COVID-19 pandemic. And can I take this opportunity to thank all of those who are at the front line, working tirelessly and selflessly to save lives and find solutions to address the impact of this cruel virus, with the physicians of BAPIO at the forefront here in Wales and across the UK. But it was less than a year ago, as the pandemic was declared and took hold, that we became aware of this disturbing news and realisation that Black, Asian and minority ethnic people were clearly being disproportionately affected by coronavirus. We saw it on our TV screens. We knew the clinicians, the doctors, the nurses, the key workers who tragically died in those early days and onwards. And the evidence came through when the statistics were analysed and stark realisation of these impacts became clear. As Minister for Equalities, alongside the First Minister, the Health Minister, we saw that action was needed to address this, and that we needed to gain the evidence and the solutions to address this exposure of the racial inequalities, that they were stark and profound as a result of this pandemic. Of course, we are talking about impacts, and it is so good that the conference already, the speakers have all focused on these impacts, the inequalities, the impact that's been felt most acutely by our Black, Asian and minority ethnic communities. COVID-19 has been disproportionately detrimental to these communities, but also exposing the deep disparities that exist in our communities and society. And as Len Richards of Cardiff Vale University Health Board has just reflected on the death of George Floyd and the Black Lives Movement, further highlighting the racial inequalities within our society, historically, structurally, and socioeconomically. And these disparities are the very real lived experience of our communities, our Black and ethnic minority ethnic communities who feel the harsh impact of the pandemic across all areas of their lives. And the facts became very clear, as Lord Kakar has highlighted. The risk of a COVID-19 related death for males and females of Black ethnicity is 1.9 times more likely than those of white ethnicity. Similarly, males in Bangladeshi and Pakistani ethnic groups are 1.8 times more likely to have a COVID-19 related death. And for females, the figure is 1.6 times more likely. An intensive care audit and research centre report on the cases in critical care units in England, Wales and Northern Ireland showed that of 8,699 cases admitted to critical care with confirmed COVID-19, a third of those whose ethnicity is recorded were recorded as being from Black or minority ethnic backgrounds. But then when we look at the wider socioeconomic context, 10% of employees within occupations in health and social care classed as key workers are Black, Asian or minority ethnic, with 2/3 of those employees being female. 7% of the people employed in industries told to close due to COVID-19 identified as from these communities. Half of the Black, Asian and minority ethnic population in Wales live in rented properties, compared to just under 1/3 of the white population. Those who rent are more likely to live in privately rented properties than socially rented properties. And minority ethnic groups are more likely to be living in the most deprived 10% of small areas compared to people from a white background. And this also varies by ethnicity. For example, 35% of people from a Black ethnic background live in the 10% of the most deprived areas. So the setting up of the advisory group led by Judge Ray Singh, as the First Minister has explained very early on, as we recognise these disparities, was fundamentally important to address this, to address the stark disparities. And crucially, there were two parts of that advisory group that was set up. The clinical group led by Professor Keshav Singhal, bringing together clinicians, leading to the Welsh Workforce Risk Assessment tool that we've already heard about and we'll hear more about in the programme today. But also importantly for my responsibilities, particularly the socioeconomic impacts group, which was led by Professor Emmanuel Ogbonna. And I just want to focus for a few moments on the work of that group. It included representation from Black and ethnic minority NHS and care workers from Public Health Wales and the NHS, but also equality groups, third sector groups, groups who are concerned about mental health and housing, reflecting on their experience, groups who are concerned about social care, equality and human rights, and also importantly, trade unions, the Wales TUC, bringing vital employment and workforce development perspectives in relation to Black and minority ethnic employees. So they all came together to look at the socio-economic impacts. And of course, the outcomes of both of those groups, the workforce assessment, risk assessment tool, and a report very speedily brought together on socio-economic impacts. But the key thing about this as well, from a ministerial perspective and from our partners, many of whom are here today, is that we didn't just have a one-off advisory group. That advisory group continues to meet, chaired by Judge Ray Singh, Professor Singhal also obviously at every meeting reports back, as does Emmanuel Ogbonna, and all the clinicians play their part. So it actually is enabling us to monitor, take stock. And I often go to those mini meetings. I slip out of our Senate proceedings to join the meetings. That's the virtue of virtual working. And I hear, you know, what is the outreach of the workforce risk assessment tool? Are we reaching out health and social care? Are all the health boards participating? What are the figures? Do we need to do more in terms of outreach in our communities? And also, are we reaching out to education, to other key workers? And that evidence and that report is all coming back to us on a regular basis. And as the First Minister has said, we now are leading from all of this evidence and from the reports that have been published to deliver a race equality action plan for Wales. And it is not just me as Equalities Minister with the First Minister who are determined to deliver this plan. It's a cross-government commitment, the whole of the Welsh Government committed to delivering this equality plan, race equality action plan, before the end of this term. Only a few weeks left, but we fully recognise that as a government we need to do more. The time for change is now, and there is no excuse for inaction. The work is underway to develop the action plan, and that will be evidence-based and include the lived experience of our Black and minority ethnic communities across Wales. Our vision for the plan is grounded in a recognition of the need for fundamental change, reflects our commitment to listen to those communities, to take action, to make change in ways that are tangible to them. We've been able to fund a number of community and grassroots groups who've never before engaged in such a public government exercise, but engaging them to listen and collect the views of their communities, the people that they represent, to shape the development of the plan. So the development of the Race Equality Action Plan is an important opportunity, but it's also a responsibility. We have to look carefully and honestly at the structures and systems in society, consider where and how we can bring about real change to the lives of our Black and minority ethnic people in Wales. Well, we can't do that without the work of the people here today who've brought to us to help bring us to this point. Your ongoing dedication to building stronger, more cohesive communities, developing mutual respect and kindness, to overcoming barriers to social inclusion, and providing the basis on which we can build an anti-racist Wales. We need to build back better, as the First Minister has said. We have those principles and ethics of social solidarity and working together, the compassion, and of course the professionalism and skill of all of those here today that BAPIO always represents. But today we are learning and listening to all of you, and it has been already a privilege to take part in this conference. And I'm delighted that BAPIO, at their award ceremony later today, are recognising some of those people who have played an important role in equality and diversity in Wales, recognising Ushaladwa Thomas and Uzo Owobi for their outstanding work. Uzo and Usha's and their dedicated teams' hard work and commitment within the Welsh Government and their own communities are instrumental in helping to shape the race equality plan for Wales. So congratulations to them both. But I will conclude by saying it was very important to me when over the past year we've met with so many groups, our Wales Race Forum, and many groups who are responsible and representing some of the people who are so deeply affected by the inequalities that have come through as a result of this pandemic. And when I went to the Women's Equality Network, and there was a GP there who of Asian origin who had said to her that she herself had felt at risk, and her whole team had actually come together to support her and consider her that she may be particularly at risk. And it's that kind of coming together and recognition of our own needs and circumstances, but those who are most disproportionately impacted, which means that our Race Equality Action Plan, covering every aspect of Welsh Government responsibility, from health and social care to housing and jobs and skills and education, that are important today. Thank you very much indeed to Dr. Singhal, Dr. Shah, colleagues and friends. Diolch yn fawr.
Thank you, Deputy Minister, for so clearly explaining the reasons that have resulted in the racial inequalities during the pandemic and the government's response to this issue. Thanks again. I now invite Professor Singh to introduce our next speaker, Professor Iqbal Singh, OBE, who will be talking to us on advancing medical professionalism during the COVID pandemic.
It's a pleasure to introduce Professor Iqbal Singh, who is an internationally renowned medical leader with great credibility in the wider community, particularly in relation to equality and inclusion matters. He has board-level experience at the General Medical Council and the Healthcare Commission, where he was a commissioner and also the chair of the expert reference group on patient safety, producing standards on the annual health check of the HCC and the adoption of a safety charter, which helped raise the profile of patient safety. As founder chair of the Center of Excellence for Safety in Older People's Care, he has led the training and education of the workforce, improving skills and knowledge and embedding a culture of compassion and respect. We were very fortunate in Wales in harnessing his wisdom and expertise for the production of the All Wales COVID-19 Risk Assessment Tool. Friends, please welcome Professor Iqbal Singh.
Thanks very much, Keshav, and good morning, everybody. Thank you for inviting me. Thank you for organizing this excellent presentation conference today. We are going through unprecedented times. The healthcare workforce is delivering excellent care relentlessly, selflessly, tirelessly, as we say. But we are also beginning to feel the strain. The medical professionalism, which is our backbone, has been stretched at times. For doctors, it has always been the values, our behaviors, our ethics that have embodied professionalism in all aspects of our work. And there are 7 key features, 7 key characters that have embodied this professionalism all through our working lives in every way and in every aspect of our work. But COVID-19 has had a devastating impact. Over 100,000 deaths in UK, but each one of these deaths is not a number. There is a family, there's friends, there's networks. And for the BAME, as so many of us have highlighted, it has been a huge disproportionate impact. A huge disproportionate impact on the communities, but an equally huge disproportionate impact on the healthcare workforce. And we know through our networks, through our friends, through our colleagues, the impact that has had, the short-term and the long-term impacts. We've had to make decisions about how we prioritize care. We've had to make decisions at times under pressure with greater challenges. But the escalating pandemic means we are having to make such judgments day after day, shift after shift. The unrelenting pressure can exact a heavy toll. Our main role is always as a healer. That's what doctors' aim has been. But the new disease, the new challenges, the inadequate evidence, though continuing increasing evidence, it has meant that our professionalism has in many ways been stretched. As we said earlier, this has had an impact on the working lives of doctors. But what we need to be sure is that when we are prioritizing access or treatment, if we make sure that we are doing it based on clinical need, on the likely effectiveness of treatments, and we need to make sure that we treat every group equally and fairly, and keep a record of the decisions, keep a record of the reasons why you're making these decisions. As a patient partner, which is the next overarching characteristic for good professionalism, this is again a new disease for us, new challenges, different needs, different requirements for us to communicate. But we need to make sure we take account of patients' wishes and expectations. But we are working in an environment of increased mortality. Doctors have commented about the weight of repeated difficult conversations with patients and families. As a team worker, we were not trained to do a lot of the things we are having to do. It has meant many doctors taking over different roles. But what it has also taught us is how to value colleagues across different systems, across different specialities, across different spectrums of activity. And how we make sure that we recognize the susceptibilities of those that are at risk and how we work as a team in trying to protect them. And one thing which we all need to learn, to practice, and to be reminded of is that we must treat our patients as we always do, but we must also make sure that we treat our colleagues with dignity and respect and compassion and kindness. That where we feel that they are in difficulty, we are able to support them and not discourage them. As a manager and leader, this has placed, again, undue demands. But what has been good is the number of leaders that have stood up to the challenge. And if we think of the risk assessment, especially in terms of BME communities, how we have stood up to develop these tools and how we've done to practice these tools. And I congratulate Keshav and the team in producing such a great risk assessment tool, not just for Wales, but for the whole country and beyond. As an advocate of patients, our biggest priority, the number one priority for doctors in patient care, is to make sure that the care they give is safe. But where there have been issues around patient safety being compromised, doctors have felt it right and have raised those concerns. And it is again important that when people are raising the concerns, we are able to support them and create an environment where they are able to raise these concerns. The next attribute for good professionalism is learning and teaching. And we know how teaching and training suffered in the first 3 months because the demands of service took over most of the teaching and training. And we were not aware and we were not used to these new methods and virtual conferences and teams. But remember, for medicine, the future is the trainees. Therefore, make sure that you are giving enough time to be able to support trainees even in these difficult times. Medicine depends on innovation, and doctors have always been innovators. But this is something like a new normal that's coming along. But what we want to make sure is that the new normal is actually no worse or even better in many ways than the old normal. We are developing new ways of working. We are doing clinics, virtual clinics, where people are not physically attending. And a lot of feedback has been that patients actually are quite happy with that. We are having new ways of teaching, the virtual conferences like the conference today. And what we are seeing is that many times doctors and health professionals are finding it easier to attend and learn from virtual conferences. And therefore, this is something we may want to continue in addition to the face-to-face consequences. So let us look upon this crisis not just as a crisis, which it is, but also as an opportunity. Let us learn how to practice professionalism and how to move forward. Now, we can't predict the future, though hopefully the vaccine is going to help us. But what we can do is, if we follow the principles of professionalism, of good medical practice, with adequate support and good health and well-being, we may be able to cope and go through the crisis. As I said, and as so many of you have said, the pandemic continues to test our skill, our resilience, our commitment, putting a strain on our mental health and physical health. And what is really important is that we are able to recognize that in addition to helping our patients and everybody else, we ourselves may need and are able to access the support when it is needed.
Thank you, Professor Singh, for highlighting the pandemic-related challenges faced by medical professionals and for your very helpful advice on how we should practice in these. We will move on to the next, and I will now invite Dr. Ashish Wagle, consultant anesthetist, to introduce our next speaker, Dr. Andrew Goodall, CBE, who will explore the health scenario in Wales post-COVID.
Good morning, everyone. It is indeed my pleasure to introduce and invite the next speaker who really needs no introduction. If you work in the Welsh NHS, he is in fact your boss, Dr. Andrew Goodall, Director of Health Services and Chief Executive of NHS Wales, a post that he assumed in 2014. Prior to that, for 30 years, Andrew has dedicated his life to the Welsh NHS, holding various organizational and planning position posts. He has been a long-standing friend of BAPIO, and you might have often seen him at previous conferences. His main focus is on patients. He focuses on patient safety, patient experiences, and service improvements through innovations. Andrew had obtained his degree in law from Essex, and then did his PhD in management of health services from the Cardiff Business School. He was recognized for his selfless and dedicated service by being awarded CBE in 2018. Now, as the first sort of glimmer of hope about the pandemic finally being at the tail end comes, more and more people ask questions about what next. And who better to answer these questions than Dr. Andrew Goodall. Welcome.
Good morning, everybody, and a real pleasure to be with you all. I was going to start off just with some personal thanks for choosing a photo from some years ago for myself. I could probably see a couple of you raising a slight eyebrow, knowing that I probably don't quite look that youthful at this stage. But also just to say what a pleasure it is, as always, to join you and to see colleagues who I've worked with across the years in many of my different roles, and also as a reminder to everybody, Keshav particularly does remember me as a baby manager in our experience together at Princess of Wales Hospital in Bridgend. I did want to start off though, just to build on other contributors this morning, including the First Minister, just to again say very much personally from me, thank you. And just in acknowledging these extraordinary times, to recognise your commitment and the support that you've provided to the people of Wales. I just wanted to say that I am very proud of you and your colleagues, and I hope that you are proud of yourselves. And I would like to ensure that that thanks is received on behalf of those people that we do support across Wales who need to access care and treatment, and particularly in these exceptional times. But I also wanted to thank you for allowing me to raise my head a little bit from what has been a very sustained and and very immediate response to COVID-19, and just allow myself alongside you to look forward to the future. And I was going to just try and draw out three areas. First of all, wanted to remind you all about our strategic context in Wales, because we will move our way out of the pandemic response and want to find a way of restoring the pathways that we had put in place in Wales. I would like to secondly reflect on just the COVID-19 experiences and the lessons that we have learned. And then thirdly, I would just like to set out some of the areas that we need to look to address in our reset and recovery process and ensure that the NHS path is in good order. So just to start with the strategic context, I know that probably alongside your own experiences back in March and April, the thought of thinking about where we would want services to be in 5, 10, 15 years would have been possibly the last thing on our list. And having introduced a Healthier Wales as our 10-year strategy for Wales just some 2 years ago, and seeing progress against that as well, I genuinely was concerned that probably we were moving our strategic reflections completely out of the way, and maybe we would lose ground. And I would just remind colleagues that a Healthier Wales does set us a template for the way in which we can look to restore and reset how we want to provide care and treatment in Wales. It emphasises the integrated system that we have in place in Wales, our opportunity to make sure that we can coordinate care across the different settings. That means across the settings themselves and indeed sectors, but also allows us to ensure that happens with the multi-professional experience that we have in spades in Wales. We have an opportunity to sponsor the patient through their experience and make sure that they should not be faced with boundaries that our structures have been put in place to support. And I would remind you all as colleagues, and many of you have obviously been working through these structures in the time, that back in 2009, we did introduce our health board structures in Wales to focus on public health and population health as priorities. We also have set out within a Healthier Wales the values and the outcomes that we are looking for our population here, the focus that we want to draw through, the challenges of innovation, particularly when we're looking to apply prudent healthcare principles and make sure that we can ensure that the right outcomes are achieved for patients. We set out our expectations for the workforce, recognising how health services don't exist without the people who support them on a day-to-day basis in all of the different activities. But I think rightly, if we look at the COVID-19 experience, we focused on the well-being of our staff and recognised the importance of looking after those colleagues who we are so reliant on to provide care and treatment. And also we set out an expectation for transformation. I, like all of you, I'm very proud of the NHS. The moment when we were celebrating 70 years of the NHS just a couple of years ago makes us all very proud of the contribution of the NHS to our system, but also, of course, to our society. But I still think we need to allow the NHS to step forward to be focusing on transformation and also with some impatience. And I think that a Healthier Wales allows us to build on some of the experiences that we will have had over these recent months, which I'll turn to in a moment. But I also wanted to recognise that the NHS has a much broader role to play in Wales, and the reset and recovery will require it to use its own resources and its own connections in its communities, particularly if you look at some of the legal frameworks we have in place, like the Wellbeing and Future Generations Act, to ensure that we can allow the NHS to not only be about care and treatment, but about its support for the broader sectors and support for our society. Final thing I would just remind colleagues of is simply the system intimacy that we have in Wales and the relationships that are in place across public services. I think that it remains an advantage for us in terms of the ability for us to collect appropriate colleagues around the table, whether virtually as today, or hopefully at some point in the future physically. And I do find it extraordinary and very helpful in my own coordination of Wales that I can very speedily collect 7 to 11 chief executives around the table at any moment for us to discuss issues of concern, and that has been particularly important through the pandemic response. So on the COVID-19 response itself, just moving to that, clearly we will have all learnt from this experience. I think we've learned a few things that we need to ensure are part of our foundations for the future. I think that we've learned that we can make change and transformation happen at pace. In many respects, we do find that the bureaucracy of our decision-making and our system can work against us. And I think we've had to put that to the side in respect of ensuring that the right level of response is in place. And I look at examples across Wales, the speed of putting in the virtual consultation arrangements, the platform to allow the technology to be in place for that to change literally in matters of days and weeks, the establishment of the field hospitals, the speed of the risk assessment process that colleagues have overseen, the way in which we had to put in very local test, trace and protect mechanisms, and of course even the vaccination programme, which has been established from scratch to a scale that we'll never have seen before within the NHS. And I do keep still reminding colleagues that it was only 3 Mondays ago that actually we were receiving the first dose of the Oxford AstraZeneca vaccine, because it already feels as though many months have elapsed since we were able to respond to that availability. Clearly, as other colleagues have said during the course of the morning, there is a spotlight on existing health inequities and population status, deprivation, obesity, underlying chronic diseases, age, and of course, ethnicity. I think we've been able to demonstrate, though, that despite those areas of concern, we've been able to bring ourselves together. And I think it's been very possible for us to have an alignment of expectations, and that would include from the organisational level up to the national level, and the way in which we have tried to work collaboratively together. But I think also the way in which we've allowed clinicians to engage with managers. And I've been a firm advocate over the years of the importance of maintaining and respecting that relationship for managers to support requirements of clinicians at the front line. But I think we also need to recognise the commitment of our staff in these extraordinary times. It's been a relentless, exhausting experience. And I do think that we have an ongoing duty and responsibility to review and look at the personal impact that this will have had, to ensure that there is support available, the protection is in place. But of course, alongside our thanks for the ongoing commitment and contributions. But I think the real learning experience for me from COVID-19 experience, and I'm pleased that this would be an experience that I have had over many years, is simply the collaborative working that has been possible about Wales working together as a system in all sorts of different settings, from the way our clinicians have worked with each other right through to the way we have worked across with other sectors, with local government, with the third sector as well. And I do think that the ability to set out a common purpose has allowed us to focus on what I think this pandemic response has been about, which has been to protect the Welsh population and, bluntly, to save lives. So moving finally just onto our intentions about reset and recovery. Clearly the NHS path needs to make sure that we look at that through all of the different settings where we are providing care. I think inevitably there will be a focus on some very visible examples of how the pandemic has affected access to care, and clearly the way in which our waiting lists will have deteriorated over these recent months is a really important area for us to be able to get back on track. But irrespective of our focus on elective work, we need to recognise that there's a number of other areas in unscheduled care, in the way that our primary care contractors are working, where things have not necessarily restored to the appropriate levels that we would see. And I think that we need to allow ourselves to recognise that we are going to have a very open description about our expectations for how we restore. I think that we need to talk about the scale of the issue and make sure that the public are aware of our commitment to do better and to do things quickly, but also the need to make sure that there are proper sustainable plans that are in place. Personally, I want to make sure that the system doesn't simply revert to the way it used to work. I think despite the extraordinary actions that have taken place at speed, I think large organizations and large systems are very able to spring back to the previous ways of working. And I hope alongside your own commitment to innovation that we can all agree that we're not going to allow that to happen. We're going to build on these foundations in place. I think that we can deliver transformation at pace, even when it's not in a pandemic response. And I actually think we have a duty and responsibility to do that as well. We can take decisions with urgency, but I think we also need to recognize that we are going to need to have investment into the resources that need to be in place to develop our response, not simply immediately, but over a number of years. And that means that we are going to need to look at our infrastructure in Wales and also the workforce that we need to deliver that. And hopefully with all of the innovation and the change of practices that we've learned. Personally, if we're going to say that we've put a spotlight on difficult issues within our communities and within our populations, we have to be driven by population and patient outcomes and make sure that we actually measure those in an appropriate manner to be able to track our progress. But I would also like to say that we must ensure that despite the fact that we have had to respond to what has been immediately in front of us with the pandemic response and COVID-19, we have a responsibility to focus on the harms that will have occurred as a result of this pandemic more broadly. So whilst of course it has been the professional thing to do to make sure that our NHS is resilient and able to respond to patients who are coming in to be cared for COVID-19, and of course it's been appropriate to make sure that our system has not been overwhelmed, we still have a responsibility to ensure that there is a pathway back for patients who will not have been able to access the care and treatment that they want. And we must all worry about the long-term impact that a lack of access will have created for patients and population who we are here to support. And of course, the NHS will have to ensure that it provides its own response to broader opportunities, for example, to focus on education and employment and the other environmental factors as well for the future. So it may feel as though our focus is with the patients in front of us, but we ourselves have to make sure that we are allowing a longer term discussion to happen, which I hope you will agree can be framed by a healthy Wales, which for me remains absolutely relevant to the way in which we're going to discharge our services. My final comment to all of you as colleagues, and it will very much focus on Professor Singh in his presentation, is that we do need to focus on the resilience and the well-being of our NHS workforce. We can never take that for granted. We've all been working in extraordinary times, and I'm not sure that all of the personal implications of what we will have all seen in our different contributions will be fully understood, possibly even for a number of years. And while society recovers itself, we do have a duty to make sure that we respond to those personal consequences that you will have seen through your own eyes and through the eyes of your teams. So just to finish, to thank you as always for the opportunity to attend and speak to you in this very personal way. Virtual working doesn't mean that this can't be an intimate set of discussions amongst us, and I've enjoyed our opportunity to maintain our relationships in Wales despite these very strange times. And whilst we're not through this yet, I just wanted to say that our response in Wales has been the better for your personal contributions. So thank you very much. Diolch yn fawr, and enjoy the rest of your day.
Thank you, Dr. Goodall. There is finally some light at the end of the tunnel. Thank you for outlining your vision to develop a better future for NHS Wales after we get through this pandemic. I now invite Mr. Jay Shah, consultant orthopedic surgeon, to introduce our next speaker, Dr. Heather Payne, who will outline the All Wales COVID-19 risk assessment tool.
Good morning. It is my pleasure to invite the next speaker, Dr. Heather Payne. She is a pediatrician for more than 30 years. She is a senior medical officer for maternal and child health for Wales. Dr. Payne is heavily involved in the Wales government's efforts in containing this pandemic. Heather represents the Wales government's views on First Minister's BAPIO committee and COVID-19 risk assessment committee. Dr. Payne represents Wales on 4 Nations committee, including the Oxford Research Group and Scottish COVID-19 Task Force. Her attention to details and ability to take others with her is amazing. Dr. Heather Payne.
Well, thank you so much for that introduction. And I'd just like to make the point that, as you can see, I have had my hair cut since that picture was taken, but I was not one of those running from the salon in Newport. It was a kitchen scissors job. Anyway, it's just such a delight to be present with colleagues and friends from NHS Wales, and a great privilege to be here to talk on behalf of Professor Kesh Singhal, because he's doing everything else. And he was the chair of this group, still is the chair, producing the All Wales COVID-19 risk assessment tool. So I just want to talk a little bit about how it's worked and how it has contributed, we hope, to the safety and well-being of all our staff in NHS Wales, but particularly to address the additional risk of our Black, Asian and minority ethnic colleagues. So the risk assessment tool, this is the front page of the site that you will land on if you look at the if you go to the Learning at Wales site, where it is readily available, and you may even have accessed it through ESR, the electronic staff record, if you're an employee of NHS Wales. This tool was as a result of the subgroup chaired by Professor Singhal on risk assessment, which was a subgroup of the First Minister's Advisory Group, which you heard about, which was set up to look at differential health outcomes in Black, Asian and minority ethnic communities. And, you know, we're aware that 40 to 50% of our trainees or NHS Wales doctors are from Black and ethnic minority communities. So, you know, apart from just the imperative to make sure they were kept safe, it was in the Welsh NHS's interests and in the interests of every citizen of Wales to maintain care and safety for the workforce. So the group met, the risk assessment subgroup first met on May the 5th. It seems such a long time ago, and so much work has been done by so many fantastic people. As you know, Dr. Haz Shah is a member, Professor Meena Upadhyay, lots of other colleagues, and the work of the group was to address the emerging evidence around the identified risk factors. We knew that Black and ethnic minority colleagues were and citizens were at greater risk. And what we needed to do was try and develop a tool to identify them readily and make sure that they were effectively protected. I will say that we built on some fantastic work that had been done by Dr. Marisha Hamilton-Kirkwood in our Bevan Health Board. They'd already started doing risk assessments for their staff, and so we you know, went from a standing start, but with a really good push from other colleagues. And I know that colleagues in the Swansea Health Board area also did a considerable amount of work to develop a local tool. And there are a lot of tools on the market, as it were. There was the COVID age assessment, which was produced by the Open Safely Data Group. There was the BMA risk assessment tool, which was led by Dr. David Strain in Exeter. And part of the problem was that these all produced slightly different results. And it was also that they weren't using specifically Welsh data, which was happening with our colleagues, Professor Ronan Lynan from SAIL, the Secure Anonymised Information Linkage Group in Swansea, working with the Q-COVID group. You know about Q-Risk, which is the cardiovascular risk assessment, and Professor Julia Hippisley-Cox was working on the big data project. They were doing fantastic work, but in May, nothing was coming out of it. It wasn't available. So what this tool did is offered us something immediate, it offered us something evidence-based, it offered us something specifically Welsh, which was evaluated and worked on by an expert group which had Welsh representatives and also a very high number of Black and ethnic minority representatives who could bring lived experience as well as their expertise to the issue. So what you see here is the landing page explaining to people what the tool would do for them. This page shows us this is the kind of business end, and again, it takes everybody. It's simple, it's straightforward. It is designed for everybody from academic, medics, right through to all our nursing colleagues, all our allied health professionals, also cleaners, domestic staff, admin and clerical staff, porters. Everybody matters in the NHS, and of course, there is often a higher representation of Black and ethnic minority staff amongst the more the less socioeconomically advantaged. So that was how it worked. It focused on health and well-being. It allowed people to assess their own risk with physical criteria, which we know are important: age, sex, obesity, other medical conditions which we knew were associated with high risk. But it also gave a health and well-being approach, saying take your vitamin D, look at, be careful about your weight, boost your well-being, and control your health conditions. Just to give you a time scale, again, it was all produced incredibly fast. 27th of May, you can see within the month we actually had a product. Kesh is a wonderful man, but he's a slave driver, and this allowed us to get the tool out for use, made it available, and you can see gradually it was made available to staff through a website, initially through paper and then through a website, and actually, because it got quite a lot of publicity, lots of other people wanted to use it, and it was used in education, childcare, social care settings, further education, and also the police. Since it was launched, and at the latest data, over 52,000 people have completed it, of which just over 50,000 are health employees. So again, that is, it's not all of our NHS Wales workers, because we know that a couple of health boards have not used this because they had already done something alternative, but they have ensured risk assessment for their staff, so we know it's available for people. And just to say that it has some pretty consistent findings. About 0.1% have been in the clinically vulnerable, and of course they should have been following the advice. About 1% have been in the very high risk, and they will have required a detailed assessment and risk mitigations, which of course the health and safety executive requires all employers to make sure. And about 22% have been in the high risk category, meaning that they might have needed additional risk mitigations, additional PPE, everything within the guidelines. But again, it's been given people confidence to actually make sure that their risk has been assessed, their individual needs have been responded to, and we have kept them as safe as possible. We've collected data on who's actually completed it, but we are also engaged in a follow-up survey of those who've given us permission to see what happened as a result, to actually measure the impact, and we're in the process of doing that. So we'll be able to report on that in the future. And that's where we are at the moment. So just a brief run through. It's certainly landed very well with colleagues who have used it. It's given people a lot of confidence that their particular situation has been taken into account, and we know that it has affected the way that people have addressed their individual risk. And as I say, we will have to wait for the evaluation to have a really clear idea about its impact. So to finish, I think that I was so touched by and moved by our prayer that we started off with this morning. And the intended use of this tool is to lead us from darkness into light, because I completely join with the prayer that we move from death to immortality. But the whole point about this tool is that we delay that journey for as long as possible for all our citizens and staff in NHS Wales. Thank you very much.
Thank you, Dr. Payne, for explaining this Welsh-specific COVID-19 risk assessment tool, which I think has been very valued by all our members.